Hey everyone, it's Dr. Bryant here, and I want to tell you about my 5 tips for natural pregnancy pain relief. What does the data tell us about back pain during pregnancy? Well, it says that the prevalence of back pain in pregnancy ranges from 57% to 69%, with back pain starting earlier in pregnancy and unfortunately increases over time. 9% of women were unable to continue their work because of having severe low back pain, while 68% of women with moderate or severe low back pain during pregnancy reported chronic low back pain postpartum, and these same women self-reported a reduction in their overall health as well. So you may be asking, what causes back pain during pregnancy? Under normal circumstances, back pain is a highly complex pain syndrome with a variety of pain-sensitive tissues like muscles, ligaments, and discs, all being potential culprits, on top of the fact of the intricacy of the nervous system that adds a level of involvement to understanding the causes of back pain. Regardless of what body part is the main pain generator, we can look to the most obvious factor as a starting point when seeking out solutions. As the months pass and the baby grows, the rest of your body will shift to accommodate for your growing belly. The lower back will gradually start to curve as the pelvis tilts and takes on an increased lumbar lordosis, while the shoulders move back to compensate for the shifting center of gravity in enlarging uterus. Lastly, the head takes on a more forward position, a condition in itself called anterior head syndrome. All of this occurs in the presence of a major hormone change that relaxes the ligaments in the pelvis to allow for an easier birth, but also makes the structures of the spine less stable and subject to increased stress. There is a high likelihood that in late pregnancy, the abdominal muscles could separate, known as diastasis recti abdominis, also leading to a change in posture. This global postural shift seen during pregnancy increases the stress and strain on the back, and as the data suggests, makes some form of back pain almost expected during pregnancy. A question many expectant moms wonder is, could back pain affect my baby's development? While there's no clear-cut research on whether or not back pain during pregnancy is harmful to the developing child, it's not a big leap to think that immobility, pain, and discomfort can make it far more difficult for a pregnant woman to fulfill her vital health requirements. Having back pain would make it difficult to prepare and cook whole food meals, which leads to an increase in processed food consumption, poor nutrients, enriched in irritants, staying on track with training and movement strategies, attaining high quality sleep, and keeping stress at manageable levels. Although some women will have access to a strong support team to moderate the aforementioned situations, dealing with any limitation is not optimal for the optimization of a growing baby's health and development. So what are the possible solutions to back pain during pregnancy? When it comes to solutions, there are 2 immediate options. A woman can either 1, seek help from a healthcare provider, or 2, explore possible solutions herself. Interestingly enough, research shows that only 32% of women actually tell their providers about their symptoms, and surprisingly, only 25% of providers even recommend treatment. This may be in part due to the fact that traditional medical management is limited by the relative contraindications of the risk to the unborn child associated with prescription drugs. This is not an indictment of the medical case management for a pregnant person, it's simply a matter of fact. So, here's how to begin solving your back pain during pregnancy. 1. Walking. No rocket science here. Take at least a 30-minute walk every day and keep the uninterrupted sitting at bay. 2. Squat. Spending time in the squat position allows you to explore the full hip range of motion, counteract the effects of sitting, and help restore proper pelvic biomechanics. 3. Foam rolling. Attention to the fascia and muscles will help your soft tissue adapt to the structural changes your body will be morphing through during pregnancy. 4. A Webster certified prenatal chiropractor. A Webster certified chiropractor can be a vital piece of the healthcare team for any pregnant woman. Unlike traditional chiropractors whose focus more attention to treating collateral damage such as aches and pains, a good thing in some cases, neurostructural chiropractic is aimed at addressing the core problem with the spine and nervous system. In the case of pregnancy, addressing the anterior head syndrome and any underlying structural problems will be central to a viable solution. But what does the data say? A retrospective case series states 94% of cases demonstrated improvement, while the overall group subjective pain score decreased by 75%. In a 2014 study, 115 pregnant women with low back and pelvic pain were assessed, and the results showed 52% of women improved at 1 week, 70% at 1 month, 85% at 3 months, 90% at 6 months, 88% at 1 year. 5. Strength training. Developing adequate strength globally and within the spinal structures can be enhanced with an appropriate strength and development program. Be sure to seek supervision from a qualified trainer or a facility. So if you are pregnant and suffering from back pain, I know these guidelines will help you to start solving your problems and feeling more like your old self again.